All right. Hi, everybody. Hello, folks out there watching this evening session on the crisis in our long-term care system. My name is Joel Harden. I'm the member of Provincial Parliament for Ottawa Centre, proud to be critic for people with disabilities and accessibility for the province. And you came to the right place, okay? Let me make that absolutely clear. You came to the right place. Keep that browser right where it is, because you will have the benefit of reflecting upon the crisis in our long-term care system and what we can do to build a better system from the perspective of three amazing women who know this system from the inside out, okay? Before I get to introducing our panelists for tonight and starting our conversation, I want to begin with a couple of acknowledgements. The first acknowledgement that we always make, and it's important to make in order to do our meetings in the right way, is to acknowledge that I'm sitting here in Ottawa in our community office on 109 Catherine Street, which is on the unceded and unsurrendered territory of the Algonquin peoples. And I know sometimes when people hear politicians say things like that, it sounds like I'm ticking a box. I want to reassure you sitting at home that I'm absolutely not. When we're talking about, in my opinion, how to change and transform the caring sector in this province, which is undervalued, underfunded, that I believe cuts right to a relationship we need to restore to this land that we're all sitting on right now. We have sleptwalked our way through 2 centuries of awful relationships with the people who once extended a hand of generosity, when people who look like me, frankly, a long time ago came to this land. It was the friendship of Indigenous peoples, including the Algonquin peoples, that helped us learn how to survive in a godforsaken cold place like Canada in January, for crying out loud. There was no central heating, there was no refrigerators, there was just people trying to make things work. And that generosity has not been reapplied to the people who first extended it to us. So I would suggest that as we think about how to be better treaty people, because that's what we all are, whether we're Indigenous or non-Indigenous, we're all walking this path of reconciliation, talking about how we fix the caring sector and reconnecting what we value and what we fund and how what we fund reflects what we value. I think it has a lot to do with a land acknowledgement, acknowledging we're on a journey here. So I want to thank my friends in the Algonquin communities all around the Greater Ottawa area and all Indigenous folks watching this. I want to acknowledge that this is Algonquin territory, and I want to thank them for their friendship. I also want to acknowledge that this is a very difficult conversation. We know that people have lost loved ones in COVID. Our office here in Ottawa Centre has worked directly with families who've lost loved ones. And I want to see you, and I want to thank you for joining this, as challenging as it is to watch a conversation like this and feed commentary into it. Thank you for your courage. We know so much has gone wrong. And if I can say anything to you to offer you a ray of light tonight, it is that in a conversation that we're going to have tonight, we are going to start growing the seeds of how to do this better. But for sure, it begins by reckoning with some of the awful things that we have seen. Over 3,000 residents of long-term care in the province of Ontario have passed away. Many organizations who are dominant in this sector, the for-profit operators, represent 58% of all of the public funding that goes into these institutions, have been getting dividends out to their shareholders, while government subsidies have been flowing to them. Folks have been dying in these facilities. Workers have been stressed out. And this is the context in which we find ourselves in. So many people have been asking this question: what's happened? Joel, what's gone on? Why did the military have to be called in once? And why wasn't it called in again? How are we seeing this second wave hit right across the province of Ontario? I'm thinking in particular, if there's anybody tuning in from Barrie tonight, I'm thinking of you. That is an awful situation that you've got in the one home in your community where only 3 people out of, I believe, 130 residents has not contracted COVID. 41 people have passed away. I'm thinking of Yacinda Bay, a 19-year-old Syrian refugee, now Canadian, but now deceased long-term care worker. And for anybody out there that wants to suggest that COVID-19 is something that can just be confined, we can just build some kind of a barricade around long-term care and home care workplaces, and that there aren't real living human beings like Yassine or Christine Mandagarian, another long-term care worker who passed away back in November, who will not lose their lives in residence. I just think we need to challenge ourselves right off the top tonight as an acknowledgement that we can't separate out our community care and long-term care from the rest of our community. So beginning with that land acknowledgement, that acknowledgement of difficult conversation of where we're at, people who've lost loved ones, families who are watching this, we see you, we feel you, we respect you, and we thank you for tuning in. I also want to take a moment to thank our three fantastic panelists who are with us tonight. Georgette Morris, graduate student at Carleton University and a quarter of a fantastic community organization in this city, Jakukombit, that believes in promoting the well-being and active, culturally relevant programming for African Canadians. It is a pleasure, Georgette, to have you with us. Thank you so much for being here tonight. I also want to thank Lynn Steele, my friend from the Canadian PSW Network. Lynn is herself a working community PSW and has spent a long time fighting for respect and dignity for folks who courageously put themselves forward to be a PSW, to do some of the most skilled work I believe that exists in this province. Lynn, thank you so much for being here tonight. And Dr. Vivian Stamatopoulos hardly needs an introduction, but I will just say this. It has been a pleasure to watch Dr. Viv hold court in debates for families. I know for a fact that long before you became a public spokesperson in this particular crisis, Dr. Viv, that families were going directly to you. And your instinct was to try to get their stories out, to give them a platform. But they kept pulling you in, as I understand it. They kept wanting you to hold forth for them. So tonight is an opportunity for you once again to talk a little bit about what you're seeing. Because not only are you a commentator for the province of Ontario, you've played a role in the national stage in helping to push us as a country get to a better place. So it is a pleasure that you're with us tonight. So let's begin with kind of an overall way of looking at this. And Dr. I want to begin with you. If you were to encapsulate the state of long-term care and describe it for somebody who may not have been paying as close attention, maybe it's just come onto their radar and they're watching tonight, or somebody who is just feeling it in here because they have suffered a loss. How would you describe the system that we have right now?
Broken. It's broken. And it's been broken for a while, so that's nothing new. But unfortunately, under this government, we have seen safeguards in place consistently chip away. And I'm thinking right off the bat, inspections in these homes, which could have detected very critical errors that at this stage of the game are life-saving. And most recently, we saw this with Roberta Place. Before that, Tender Care. Before that, Sunnycrest. I mean, it's just time and time again, a series of preventable errors and mistakes caused by a consistently underfunded and understaffed system that is leading to mass mortality. And we have very clearly articulated to this government the various actionable items that they could institute, and they should have been instituting months ago in preparation of the second wave. But sadly, we have seen a pattern of inaction or far too little action and far too late. And we're at a stage now where more homes are in outbreak than ever before. The Science Advisory Table, featuring Dr. Steiny Brown, who I always love when he talks because he scares the hell out of me. He revealed and projected that we are going to have a more deadlier second wave than the first wave, despite having, well, we should have PPE now, and that was the biggest problem we didn't have in the first wave. We had the global shortage of PPE. We have PPE now. We should have learned lessons from the first wave, yet it is going to be a deadlier second wave. And a lot of that is preventable, and seeing families go through this pain that they really shouldn't have to is probably the most difficult part.
So if you were to identify, Dr. Viv, the few things that have led to us not being ready at the second wave, forget the first wave.
Yeah. I mean,
what are they?
I mean, we can compare us to Quebec. That's the best comparison, right? So Quebec learned after the first wave. So right at the end of, I believe it was May, the start of June, they said we're going to need to shore up staffing. That is going to be, without a doubt, the biggest undertaking that we need to do to protect these homes. And everyone knows that across the board. So we didn't do that, right? We were saying, do the same thing that Quebec did. They hired 10,000 workers ahead of the second wave. They paid training and offered a starting salary of $50,000 for their equivalent of PSWs, personal support workers. And within days, they had 70,000 applicants. So it is possible, if you actually provide a living wage, to attract workers to this sector. in addition to that, they didn't implement infection prevention and control managers at each home. That is something that Quebec did. And had we done that, I really doubt we would have seen the problems that we had at Roberta Place, the problems at Tender Care, the problems at Sunnycrest, problems at St. George. I mean, it's the same problem. It's the same story every day, same outcome, different home, completely preventable. One thing that we had suggested this government do is to update the staffing levels at each home in real time and to publish that on some sort of public website. And this is also something that the long-term care commissioners corroborated as well. Doing that would allow people that have actually been paying attention to flag staffing collapses as they begin, so that we could actually institute a more proactive response. Because right now, the modus operandi of this government is to wait until the house is on fire, and that advocates and experts and whistleblowers and frontline staff who are whistleblowing have to inform the media how terrible things are, for then there be a mad dash reactive response to get the neighboring hospital in there. I mean, this is ridiculous that this is the way we're still handling this 10 months in. And it doesn't appear that this government is planning on actually taking a more proactive response, especially given that, Christine Elliott herself said that the new iron ring is vaccinations. So, this is the very upsetting part now, that it would appear that they are just waiting out the clock.
So wait, I missed that.
Oh, yeah.
So the Minister of Health recently said that the new iron ring are the vaccinations that haven't rolled out yet, the 130,000.
He absolutely did at a press conference. Yes.
Oh my goodness.
That's public record.
So before Georgette, before turning to you, I just want to set the table, Georgette, a little bit, because what I forgot to say is your mom is working in this sector. And by the way, if your mom is watching this, thank you. Thank you. Thank every single PSW. We're coming to you in a second, Lynn. So when you hear that the government's strategy to protect long-term care and workers in the sector is wait for the vaccine, how does that make you feel from a research perspective about how prepared we are to make some significant changes in the sector if we can agree that it is in deep crisis right now? I think you're on mute, Georgette. Oh, there you go.
Oh,
Yes.
Georgette.
Yes, sorry about that. It makes me very, very concerned because, like we've heard here today, like this is not new. This didn't pop up overnight. And we have case studies that we can do comparative analysis with to show that, one of the biggest resources and thing that we need is people. And if we're not protecting our people and if we're not caring for them, because what we have to also take into consideration is the individuals who are in these positions. Often they are racialized women that are working in the care sector. And this, again, like historically, this is not an issue. This is not something new, right? If we go back and look at things such as the West Indies domestic scheme, we look at the living caregiver program, and the notion behind those programs from an immigration programming standpoint, they were to bring women in from the global south to do these care work. Generally, they were domestic work, and often what happened based on discrimination is that these women then transferred into hospitals, into care centers, into long-term care facilities, because that's who was open to hiring them. So I find it very concerning at this point that we're still at this same point. We shouldn't have to be here anymore. And to say that, we're only counting on vaccines, that's not sufficient, because what we have to take into consideration, these are real people, right? Because if somebody gets sick, and arguably, the residents are in there, the staff are in there, we're concerned about them both equally. But however, whether it's a resident that brings in a family member or somebody, all of a sudden you have staff that are sick. If we don't have staff to replace them, what happens? It puts pressure on the other staff. And by putting pressure on people, we know that weakens people's immune system, making them more susceptible to this, COVID-19. So at this point, it's grossly concerning, and it's something that's very sad, and it's really frustrating.
So if you were to think, Georgette, from your perspective as a researcher, someone who's followed care work, the minister, hopefully we can convince her and her government to act with more urgency, and that's what we intend to do as the official opposition caucus. I promise you that. But if Christine Elliott were right here right now, and you were to flag to her something she should be saying to her colleague, Minister Fullerton, who's responsible for this sector, what would you tell her from the perspective of the grassroots perspective you're talking about, the largely women, racialized folks who are working in this sector? What would you tell her?
I would tell her that, for one, we need to come to some national type of standards, and that there needs to be some type of collective body creative, and this body would be something of a federal, provincial, territorial agreement where individuals who work in this particular sector will be paid a rate that is respectable, and that there will be things put in place. Because the thing is, what we have to take into consideration is that this issue crosses all levels and all all parts of society. And if for one thing, if we're looking at, let's say, publicly funded long-term care facilities, that's different as it relates to benefits and what may be in place for workers there. Now, when we look at private long-term care facilities, there's a whole different schema there, and we have to be cognizant of things like if there's not paid sick days, and if there's a lack of paid sick days, how can we reasonably expect somebody to get better? And I'm sure we're aware of the information like that's being found right in the Greater Toronto area, that many people may have symptoms, are not getting tested because they don't want to lose out pay, because they don't have enough days to be off. That is highly concerning. So one of the immediate things that I would strongly urge this current government to do is to look at making sure that there are normal benefits and salaries and compensation put in place for the workers to ensure that they are healthy, because at the end of the day, these are the individuals that are taking care of our individuals that are perhaps too young, too sick, and too old to participate in our world in a way that they once have. So those are some of the main concerns I'd bring to their attention, and also to, be a bit more responsible, not to do things that are switching on a day-to-day basis, because it's tiring for the workers that are in this. They're trying to protect their families. They go to work and they have to do, workers now have to go to work earlier. They have to make sure they go in, get their temperature checked. They have to make sure they get their PPE equipment. They have to, even something as simple, some workers may have an allergic reaction to the mask. They have to make sure that they're constantly being tested every single day. They have to do a survey to say, have you gone anywhere? Have you contracted COVID-19 every single day? And that's a lot of work. And not only that, but they go home to their families and, they have to do things as go home right away, take a shower, put their clothes in a bag, separate their laundry because they don't want to bring it home should it be there. So these people are risking their lives day in, day out. And I think it's egregious that we haven't really done anything since the first wave. It's quite befounding.
I hear you. Lynn, okay. I'm wondering if you could help people watching this tonight understand from a PSW's perspective why certification and regulation and standards for the profession in this industry is so important to you, and why this was an issue long before COVID, and why, as I've understood from you, why it becomes all the more important now to make sure that these are careers, meaningfully paid, respected. Could you help people watching this understand that a bit better from your perspective?
Well, I think every single point that both Dr. Vivian and Georgette have made, couldn't have said any of it better myself. It was exactly what I was thinking. So part of the issue is when you have PSWs that have that respect and recognition and they have that certification behind them, they tend to be upheld to a higher standard of training, a higher standard of the education, and a higher standard of practice. Right. So they may be able to, through their education, access better and more concise training than somebody who, say, has not gone to school. Mm-hmm. A lot of things are covered in a lot of the training that there is available in the schools. Like, for instance, you heard a lot of PSWs saying, we're not prepared for this. We don't know how to deal with this. We don't know how to handle this. Well, yes, you do, because it's been taught in all of your infectious training that you've had. It's no different than when you encounter residents with the flu or with C. diff or anything, TB. It's still full PPE, full practices in place. And these are the things that they are trained to do. They are qualified to do. But I think the biggest part of it for them is the fear of the unknown, because this is so unknown and it's so new, and they just didn't know what to do with it, which kind of brings me around to the other point of the biggest issue that I've been hearing from all the PSWs, and it was brought up to the attention again, was that there is a lack of communication from the employers of what is going on, what is happening, clear instructions, changing day to day. It's a lot of weight to be put on the shoulders of the PSWs and the frontline healthcare workers, and they can only do so much with what they're given. And I think that's a really big issue, that there's so many things they already have to deal with on top of having beyond inadequate wages. We already all know that. The severe understaffing issues, that is a major problem. Mm-hmm. Let's be honest, they're all getting tired, they're burnt out, they're exhausted. Mm-hmm. And what happens when we get tired, burnt out, and exhausted? Our immunity drops.
Right.
It all goes hand in hand. They have time constraints on how long they can spend with each person.
Right.
I've heard of PSWs actually being reprimanded for taking too long with one resident. That is absurd, absolutely absurd. Why should you be reprimanded for taking that extra time and care to do your job? Because that's what our job is. Going, we all go a little above and beyond. And that's what makes all the difference. And the fact that there is such little respect and recognition and just lack of support from their management, it's very concerning. And it just brings together all the things that Georgette and Dr. Viv were just saying. Is it's becoming a really hard situation. And we all know the system is broken. We've known it for years. Nobody wants to hear that it's broken anymore. Now is time for action. Now is time to start listening to the people that are on the front lines. And that's another part of the issue, is that they're not listening to the experts in the field. They always talk about, oh, we've spoken with the experts, we've consulted with the experts. But have you really? Because I don't hear a lot of the PSWs being asked.
Right.
They're the ones on the front line. They're in there every day. They're the ones doing the work, yet they're not being asked anything. They're not being consulted on anything. They're not asked for their feedback on anything. And if they are, where is that documentation? Because all of the surveys that we've put out on our website, we leave them up indefinitely. We leave the analytics up for the public to see. And we leave all of their voices right there. If they choose to make a comment, they choose. If they don't, they don't. And that's, again, part of the topics that were just mentioned. I had actually printed off right before we started. So we had updated, accurate information that 85.4% are a PSW and 93.2% are female. Age bracket was actually quite surprising. 33.3% are over age 50. What are we going to do when they retire? Because the next bracket below that is 45 to 50, and there's only 18.9% are working as PSWs. And the last one is 38.6% work in home care, 26.3% work in long-term care. That's a huge chunk, huge. So we need to start listening to those workers. They know what's going on every single day.
So I know, just so people, you're of course going to be modest, Lynn, so I'm going to push you a little bit so you can talk about the work you're doing, because I know you're talking to all of us politicians, trying to push all of us, which is what any advocate should do. But if you're to encapsulate why we're a bit stuck here, and I'll just take the liberty of saying being stuck, because in our city here in Ottawa, there's a 60% turnover rate for PSWs. This is what our local health information network is saying. People come into the profession, they leave. And we are churning through people because you're one staff to 30 residents, or you're only getting part-time hours and you're moving between different places, working for an agency, which is the loophole, if I understand it correctly, Dr. Viv, that operators have been using. So people are moving between homes, which makes us more susceptible to this virus. So, Lynn, do you ever worry in all of your pushing of all the politicians that as we're talking about this conversation in the pitch tones that we're talking about it, because there's some awful stuff happening out there in the community, that we're actually turning off more people from entering into this profession? Are you worried about that?
Absolutely, 100%. Because right now, when I'm going through my social media and when I'm seeing posts like, comments of people saying, well, I was really thinking about becoming a PSW. Now I've changed my mind. Or, wow, the one that struck me the other day was, boy, those pots are sure quiet banging now, aren't they? Great to call me a hero, but now what?
Right.
So they're feeling again, it goes back to not being listened to. They're feeling defeated. They're feeling like they are inadequate, that they are undervalued, that they are just not valued, period. They have no recognition, they have no respect, they have nothing to show them. I mean, they have to work multiple jobs just to make ends meet. You and I spoke about the two ladies that, were living in a shelter.
Yeah, here in Ottawa. That's
Why?
Yeah.
Why are they living in a shelter?
Mm-hmm.
So my big question is, you want the PSWs to continue to provide the most safe and dignified and respectful care to everybody they take care of. But when are they going to get the same in return?
Hmm.
And if we do not start valuing them, they're going to keep leaving. I'm sorry. They don't want to work for the minimum wage that
Right.
PSWs get, for the responsibility they have of taking care of human lives.
Right.
It's a huge responsibility. And they're being treated like, yeah, you can make the same amount of money as your 18-year-old. Don't worry about it. And that's really making them consider and reconsider staying in the profession. We need to do better by those workers, because they are the absolute foundation of the healthcare system. They report to the nurses in turn report to the doctors, and then all of the decisions are made regarding their care. What happens when foundations crumble? Just saying.
Right. Dr. Viv, you mentioned before the case in Quebec, and it brings to mind stories that I've heard our health critic France Gélinas talk about. And that is that anytime a hospital issues an employment opportunity for now I'm getting to your territory, Lynn, the 41 different names given to PSWs, right? And in the private sector, it's often to bid down wages. But when a hospital issues help for a healthcare assistant, for example, there are plenty of applications. If I understood you correctly, you said 70,000 people applied to be part of Quebec's big hiring push this summer?
Yep.
And what's at the root of that? What can Ontario learn from that?
Well, Ontario needs to learn two things. One, and Quebec did one of two things, right? So even just paying a basic living wage of starting salary of 50K and paid training, that was one side. But I also, was very critical of our own government for, trying to tout the pandemic pay increases that are, temporary as somehow beneficial, when all that was a 461 million federal Band-Aid. Because yes, it's a temporary support, but the problem is, until you address the working conditions, it's not going to attract more workers, right? So I'm sure, even though they were able to retain some additional workers in Quebec, I wonder how long they'll last, given the working conditions are still abysmal. So you have to address both. It's working conditions, it's pay. And the main issue with working conditions are the staffing ratios, right? The fact that one PSW has to care for sometimes 30 during the day, sometimes upwards of 60 residents at night. It's completely untenable. You put these women in positions where they're designed to fail, and then you wonder why there's a 50% turnover rate. That's the Ontario-wide statistics that were part of the Wet Lawfare Inquiry staffing study that just came out in July. You wonder why. And these women are not stupid, right? A third of them, as per SEIU, left after the first wave because they said, forget this. We're not going to risk ourselves in these post-traumatic stress-inducing conditions, wildly stressful, dangerous working conditions in that first wave, where many of them got sick. They saw a lot of the people that they grew to care for as residents die in terrible conditions. 30% of them left. And, the unions were very clear that you can attract these workers back if you actually guarantee their working conditions will be safe and more tenable.
Right.
In addition to, the temporary the pay bump is not going to do enough to get them back. And you can't blame them.
Right. So it's not about danger pay. This is about health and safety. And
of course,
if we were to start poking at why there is consistently more dangerous practices in the private sector, I mean, as I was getting ready for our conversation tonight, I saw a HuffPost story I can't repeat the words because my grandmother, bless her soul, she heard me say it on television, would not be very happy. But there was families recounting what people are being fed in long-term care homes and the working conditions for a lot of those cleaners and food preparatory people in very unsavory terms, right? Why does this keep happening? Why, at this point we have 50, if I understand the latest numbers correctly, correct me if I'm wrong, 58% of the long-term care sector right now is privately held.
Yep.
It's publicly funded,
yep, but
it's privately held. And in many cases, we have 40% of all homes with outbreaks right now. Why, if for viewers at home who are just trying to make sense of this, why is it consistently the private sector that's caught up in these critical incidents, that's caught up in unsavory food, in low wages, temporary hours, lack of infectious disease controls? What's going on?
This is privatization. When you privatize, the whole point is to increase profits. To increase profits, you cut on a variety of different elements of care. The most important one that we've seen cut is staffing. And keep in mind, and I try to give this, historical backdrop, that if you look 20 years ago, when this was pre-Mike Harris, so Mike Harris was responsible for the privatization market model of dominance we have in Ontario right now. Thanks, Mike. Order of Ontario. But so when he gave the 20,000 bed contracts to largely for-profit providers, what we saw over the previous 20 years, whereas before the primary staffing mix of nursing homes was nurses, hence the term nursing homes, right? This is a regulated, higher skilled, higher paid profession. If you want to cut on labor costs, and look what happened over the past 20 years, you suddenly move away from staffing, and now we see the staffing mix is flipped on its head. Now they have effectively abused and exploited gendered and racialized workforces. So many of these women of color that often are new to Canada, and quite frankly, are just need some foray into the labor market and are in a position where they don't have more opportunities to speak up, right? So this is a situation of desperation for a lot of these women to make ends meet. And unfortunately, this has been the tool of exploitation. So you flip the staffing mix. So now the majority of workers in Ontario long-term care homes are PSWs. It's an unregulated profession, wildly varying degrees of training, a lot of, unfortunately, a lot of improperly trained workers that are, and I'm not blaming them, I blame the providers and the agencies who don't properly provide them training and throw them into these very precarious and dangerous, situations.
Right.
And then you see what happens, right? And then not just staffing. Staffing is the biggest way you cut costs, but then you see in privatized homes, they do things like they outsource food. And food is one of the biggest things that is important to residents. So in the municipal homes, not-for-profit homes, you don't see to the same extent. So you see privatizing food out. You start privatizing ancillary services like laundry. Do you know how many times clothing goes missing in a lot of these private homes? I hear this all the time from families, right? My grandmother was in a nonprofit home, and this still happened because still some nonprofit homes mimic the strategies now of the for-profit home. And some of them actually use privatized management agencies, right? And Extendicare being the most popular and the most commonly outsourced nursing home group, right? To manage other homes. So now you don't only need to ask, is the home private? Now you also need to ask, who manages the home? And we see in homes like Tender Care, homes like Roberta Place, these were private homes, further outsourcing their management to private firms. So this is layers of privatized incompetence. And you see this kind of thing. You're outsourcing everything from food, laundry, cleaning services. And then that also introduces more risk because you're bringing in more people into the homes. It's just, it's not good for anyone except the CEO's bottom line. It's not good for residents. It's not good for workers. It's not good for obviously their families. The only people that benefit from this are the CEOs.
So if we have a situation in which, and I just want to do a quick shout out for people watching this, if you haven't read his work yet, folks should look up the work of Zaid Nursimar, who until recently was an independent researcher for a number of different publications, including rankandfile.ca. And the picture Zaid has painted of our sector is one in which there is an interlocking relationship between political parties, mostly liberal and conservative, but not exclusively, if I'm being honest, political parties and lobbyists for the for-profit care sector. For the most egregious one that comes to mind for me, and Georgette and Lynn, I want to get your reaction to this. Last April, when the wheels were completely falling off the truck in the sector and the outbreak was soaring, on April 26th, a very interesting moment happened. Melissa Lanceman, who used to be Premier Ford's campaign spokesperson in 2018, handled all the media, handled the war room, very skilled person, I'm sure, registered to be a lobbyist for Extendicare on that day. And she wasn't alone. There were 4 others, high-ranking conservative officials that registered to be lobbyists in and around this time. So I guess, why don't Lynn, I'll go through to you. When you see your colleagues and you yourself, because you're out there in the community visiting people in their apartments and in their homes, when you see the need and the need to be brave and the need to, like, it's like a burning building almost. It must feel like that sometimes, you know, like you're going in, you're risking yourself, right? And then on the other hand, you know, you get a chance with revelations like Zaid Nursimars to look askance at, you know, some of the political class. And it's not unique to one party, if I'm fair, but moving from political life into lobbying life for-profit long-term care homes. How does that make you feel?
Disappointed. You know, I mean, when you're in the position that I and other PSWs are in, I mean, we're all about making sure that people are safe and taken care of and putting them first, above and beyond ourselves and our own families. And it's almost like you feel like they're trying to almost undermine everything you're doing. And you feel like everything you're doing is almost in vain.
Right.
And it goes to the PSW morale of, now we have so many that are sitting there going, why am I doing this? And they keep doing it because they care. And they keep doing it because, and I know a lot of them think the same way that I do. Yes, the conditions are terrible. Yes, there's major understaffing issues. I don't care what anybody else says. It exists. It's real. It's understaffed every day in every single long-term care home in Ontario. Anybody that says different is either lying or has no idea because they're not in it, period. So when you have us sitting there going, okay, we need to do something to help, we will continue to work under the pressures, the constraints, the issues that we do, because we keep going back every day going, but I am going to make that difference. I'm only one person, but I'm going to keep doing it because I know I can make a difference. And I'm worried about the people that I take care of, that if I quit, are they going to get the same kind of care that I give them?
So it's
PSWs are so selfless. They are truly selfless.
Wow.
And yes, they are heroes. And yes, they should be far more recognized and respected than they are. Absolutely.
Pay me like a hero.
Yeah. And it's not always about the pay.
Fair.
So it isn't always about the pay. And I've actually had people say to me, well, if it's such a crappy job and it's such a crappy pay, then why do you do it? Don't complain about it. You knew what it was getting into it. Yes and no. Yes, because obviously when we all go to school for this, we are told, let me back that up. When we are watching the commercials on TV that are about, you know, bring your family member to this home or that home, you think, oh my God, that's amazing. This is great. You see the home care commercials where the PSW is taking the gentleman for a walk to the mailbox. The other one is having tea and playing cards and reading the newspaper. The problem with that is those commercials are geared to the families,
Right.
not the PSWs.
Right.
Because yes, you do get great clients like that. Absolutely. I had one gentleman in home care. Oh my God. He was a doll. He refused to let me in the house unless I was at the front door with my coffee in my hand. If I did not have a coffee in my hand, he would make me turn around, go to Tim Hortons, and come back. No word of a lie. So there are some that are like that. They're very simple care. They're very basic. They're very easy. Not all of them. You do get bedridden clients in home care. Absolutely. And when you're going to school, they don't talk about that. They don't talk about how heavy the workload is when you get into long-term care.
Wow.
Exactly. And even when you go in to do your practicum, you're working as a team. You are working with other PSWs. You are working as a collective where they're all trying to teach you together. They're all trying to help you move along and maneuver through it and learn it together. What they don't tell you is the minute you are hired, you are on a team of pretty much yourself and one other person, if you're lucky. That's where it gets really hard, because especially when you're understaffed, you have to sit there and wait in the hall for somebody to come and help you do a transfer. You cannot do it alone in long-term care. You cannot. It's two-person transfer. You got to wait. And if you have to wait for either the nurse to be available to help you or another PSW to be available to help you, you could be waiting a very long time, which goes back to the time constraints. Right. So it's this horrible circle of non-stop issues that PSWs are faced with that constantly, it just keeps spinning and spinning and spinning. And at what point are the spokes going to fall off that wheel? And I think we're actually coming to that point where they're not just coming off the wheels, they're flying everywhere. And now, as Dr. Viv said, it's scramble mode.
And Georgette, when you're thinking about what you've seen, the scramble mode, the fact that what Lynn's saying, the only reason people are in this profession in the first place is because they care. And they care so much for their patients, they want to make sure they get the kind of care that they're offering them, right? I mean, when I hear that, it makes me ask myself, are we living in a predatory system where, people who have those amazing caring skills, I mean, I'm not sure if it's something you've reflected on, but I had once a call from a PSW who wanted to remain anonymous. As Lynn has confirmed with me, most PSWs who I've had the conversations with, they all want to be anonymous.
Well, they have to.
Yeah.
They've been a lot of them have been threatened with reprisal.
Absolutely.
Flat out, if you talk, you're out.
Absolutely.
So, to me, it makes me ask myself this question: have we been given a predatory system, which is trying to take advantage of people who actually want to provide meaningful care and want to help their patients, their clients? Is that the root of it, Georgette? What do you think?
I think that's definitely a part of it. But I mean, circling back to what we've said earlier, there's so many issues that have gone on systemically for so long, it doesn't help the circumstance. And because we're in this private sector model, it's really unfortunate. And, something that they have in many nursing homes is a residence bill of rights. So this is a document that, generally that, the environment is going to respect the residents, treat them well, and so forth. You also have organizations within generally some long-term care facilities where you have residents a group. So if they want to, let's say, bring something in or do something, they vote amongst themselves and they do those different things. And I think it's really ironic that, we have these institutions, if you will, that have these residents' bill of rights, but yet we care for the residents, but we don't care for the staff. It's a very broken system, and it constantly remains broken. And I think it does take advantage of individuals, I would say, capacities or perhaps their empathies, because you do get attached in any nature of our work. You get attached to the subject. whether that may be in research, whether that may be something practical, but you develop some type of connection. And I think it's, it's very unfortunate that we have individuals that are so vulnerable in so many different ways that are in the system, and that they can't really get out, and that there are, consequences if they choose to speak out in certain ways or in certain forums. And yet they had to go in, day out, and just try to wait for a better day. And I think it's insufficient. I think we're doing a huge disservice to many people in this country, and it's really unfortunate.
I want to jump in there
No.
because the Residents' Bill of Rights is laughable. And if we're going to be honest, it is not followed. And one of the first things that I did was when they levied those no visitation rules in March 13th, was I wrote about how all the many ways that was violating key rights within the Residents' Bill of Rights. And these rights are trampled with impunity often. And frankly, we know that there is very substantial rises in resident abuse and neglect, and nobody wins here. I mean, I saw this firsthand. I lived in this sector for the better part of a year with my grandmother, and I saw all of the neglect. I saw this system play out, and I would try to speak up. Where did it get me? It got me avoided by everyone. So I'd walk in, it was like everyone would hide when they'd see me, right? and the email suddenly wouldn't be answered, or and I'd have to keep following up and harassing people, asking, well, why is this happening? Why is this happening? This is not good for workers. This is not good for the residents. Why are you doing this? And then I became the squeaky wheel, right? And this is the thing. You try to whistleblow, and then you have to worry, are they going to take it out on my loved one? Are they going to provide inferior care now? Or
trespass?
And this is, so not only are workers scared, residents are scared, their families are scared as being advocating on behalf of, not only I would complain to the home about how they were bringing in agency workers that didn't know the residents and were actually harming them. Like, my grandmother said at one time she was hurt. She was roughhoused by, a PSW came in the night shift and didn't know who she was because they were using agency workers at night. I hear they do this frequently across the board. And we, I obviously raised it, and they said, okay, we won't have them in, with your grandmother again. It kept happening. And I would kept trying to whistleblow. And I said, this is not, you need permanent, full-time, regular staff. This is not good for continuity of care. You have to know your residents.
Right.
Workers that are in the homes and get to know and have relationships and understand, for example, that my grandma had really bad spinal arthritis. So if you move her in certain ways, it is excruciating pain. You don't just roughhouse someone with spinal arthritis and degenerative disc disorder. But when you bring people in who don't know the residents, this happens. It's just across the board. Nobody wins. Nobody's winning here. Workers aren't winning. The families aren't winning. The residents aren't working. It just pisses me off.
But you know what you remind me of, Dr. Viv, is a vignette from a very famous novel written by the novelist Kurt Vonnegut, who talked about this cruel older brother in the story of putting two ants in a jar and shaking the jar to make the ants fight. And this was his afternoon pastime. And sometimes I wonder, in situations like these, it's never to excuse, as I know, Lynn, you're on record saying bad behavior. The reason you want the regulation and clear standards in your sector is so people who are engaging in practices like you're describing, Dr. Viv, are not in the profession, right? I totally take that point. Why are we so loath to ask the question of who's shaking the jar, right? The families are the ants in the jar, the workers are the ants in the jar, the residents are the ants in the jar, but we don't ask the question, who is making this situation so untenable, that someone is so intent on running a profitable company that it's going to be done at the expense of full-time staff or nutritious meals or meaningful visitation rights for homeowners. So Lynn, to throw back to you for a second, I'm wondering, because you are a PSW, just enlighten people who are watching this into some of the many skills. What's it like to earn the trust of a dementia patient?
Oh God, there's
feeding
nothing, there's nothing like it.
Tell us a little bit about it, because I don't think people who don't have your skills and the skills of PSWs understand the amount of work that goes into that.
Well, I first want to definitely say, hats off to you, Dr. Viv, because you know what? People, I'm watching you get emotional, and I'm finding it very hard not to get emotional. And we need more people to get emotional, get angry, get upset, do something. do something. We can't just keep complaining and complaining and complaining, because I think the old saying is complaining without action is just whining. So you know what? Everybody that's doing this advocating, God bless y'all, because you're not whining, you're doing something. So for me as a PSW, watching someone like Dr. Viv getting so emotional, it breaks our hearts, because we try so hard to do the best that we can with what we're given and what we're allowed, that when we feel like we can't do more or do better, we take that right to heart. We feel responsible. And the biggest thing is absolutely the continuity, 100%. And when I took my my designation for my CDCP,
What's that mean? What's that acronym?
That is for a certified dementia care provider.
Okay, thank you.
Yes, and that is through a wonderful partner of ours, Karen Tyrell. She's fantastic. It's an education program for dementia care, and it's through Personalized Dementia Solutions. And she can be easily found on our website as well. One of the things that I really learned was that I actually learned I didn't know as much as I thought I did about dementia, even though I have cared for multiple people with dementia, my own family with dementia, my grandmother. It's kind of the, if you've met one person with dementia, you've met one person with dementia.
Yeah.
Because it is so unique and so individual. So when I find that when you get that trust of that person with dementia, we'll use that one as the example. It's awesome. It's really awesome, because they start to, when you have that continuity and you have that consistency.
And by continuity and consistency, you mean you're the one consistently providing the care.
Correct. Yes, we're consistent and continuity with the person, and not just the care that's provided, but the way it's provided, the person that's providing it. Right. They actually will start to recognize you. And I had one lady in particular, she never, ever, ever remembered my name, ever. But it got to the point where when I would show up, I'd come in the living room and she'd be sitting there waiting, and she'd just brighten right up. She'd go, oh, it's you. She never knew my name. You could ask her a million times. She would never know it. But she knew who I was, that I was there to help her that day. I was there to take care of things for her that day. And she was so happy to see me every time. And that took a really, really long time to build.
Right.
I've had nonverbal clients where they don't speak. And I'm really hoping that one of my preceptors from back when I was in school, I'm really hoping Rebecca's watching this, because it was an oh my God moment. We had one resident, this was in long-term care, we had one resident who never ever spoke. And I desperately tried, and I'm like, I'm gonna do it. I finally got him on an eating schedule and a routine. And I figured out, just by being persistent and being patient and trying a few things, I figured out why he wasn't eating, but for me, he was. And all it was simply that he just liked extra brown sugar on his porridge. You had to if you cut the toast into little squares, he'd actually pick it up and eat it himself. And I kept trying, and I always said the same thing when I came into his room. I'd say, hi, it's me, Lynn. I'm here today. And he would smile. And then finally one day, we were all out in the recreation area, and dead silence. And all you hear is, Lynn. And we all whipped our heads around and went, what? Not only did he speak, he called my name. Oh my God. And I said, what is it you would like? And he said, one word, chips. I ran down the hall to the vending machine so fast because I was like, oh my God. And it's that, oh my God, that we're all looking for. And it makes it so worth it. And you know, you've made a huge difference. And all it takes is just one.
Oh man. Lynn, that was powerful. I mean, just the notion of connecting with someone's authentic self, of wanting something and being heard. And that must have been quite a moment.
Yeah. And you know what? That's all of our residents, whether they're in long-term care, whether they're at home. That even goes for the family members. That goes for the PSWs. It goes for the nurses as well. Every person on this planet wants to be heard.
Amen to that.
They don't just want to be heard. They want to be heard and understood and validated. That's everybody. And when Dr. Viv's telling me, they're family members, they want to be heard. Their voice is just as important as the resident's voice. The PSW voices, they're just as important. And, I think when we're not listening to those voices anymore, it goes back to your question, Joel, of who are we listening to?
Georgette, before I ask, there's some folks who've had in questions. I want to make sure that those questions get posed. But when you're hearing Lynn talk about that moment of that aha moment that happened to her, have you heard of that happening with anybody? And, I don't want to put your mom on the spot here, but have you heard of that moment? I want to give you an opportunity to talk about the caring profession and those moments like that, when you really connect and you feel like you're making a difference in someone's life.
Absolutely. And I think, it goes right back into the conversation of the continuity of care, because care is not only just, let's say, the medication somebody requires. It's those connections. It's, knowing that person, it's knowing their reality, knowing their family, something as simple, we maybe take for granted, let's say somebody, there's a new resident that comes into a nursing home, they come in with some of their clothes, they feel comfortable when they, have their favorite sweater on. And it's just something as simple as ensuring that they get their right clothing, ensuring that they're eating the right dietary concerns. And it's really heartbreaking to hear things like when we're using privatized workers that are not as careful or cognizant of the needs of the people, because not knowing those needs can be detrimental, if not deathly, to the residents. Something I can think of very simply is, there are rules that if you have two PSWs, that you have to have two to do a transfer. There's been many organizations that have gotten, sued because they're understaffed and one person tries to do it. And that's a normative reality. That's concerning. So I think it's great when we have moments like this where, those connections can be made, that there's the time and the resources that are put in place. And, there are events when this happen, but it's equally as concerning when those things aren't happening.
Right. Absolutely.
Georgette, you just nailed that. Absolutely.
Jerry's asking us a question. Jerry writes, what other system is Ontario's long-term care system modeled on, the one we currently have? And was there a point ever where Ontario's long-term care system wasn't broken? Does anybody want to take a stab at that?
Pre-Mike Harris days.
So what did that system look like, Dr. Viv? If we're
municipal, publicly provided, some not-for-profit homes. That's where we need to go back to.
Okay. Just around standards in the sector, around everything under one roof, food, management, programming.
Unionized workers, better pay, better conditions. I mean, the city of Toronto themselves, they're so innovative. I'm doing some work with them right now on a technology project, but they themselves fundraised, I believe, 23 million so they could introduce the 4-hour care standard. They've been doing this before anyone else. And they did that on their own accord, the City of Toronto homes, right? So we have Premier Ford trying to act like he's so helpful by offering, that care standard in 5 years. Meanwhile, the City of Toronto fundraised and got it done in a year. Okay. This is what I'm talking about, right? They value work, they value their employees, they value the residents in these municipal homes so much more than you're ever going to see in these privatized homes.
Right. Anyone else want to dive in on this question? Is there a moment that you can remember the
I
system?
think definitely when it comes to things like in particular, when we're doing those inspections, I hear Dr. Viv chuckling over there. Yeah, they need to do them. And I know everybody says, yeah, they're surprised. No, they're not. No, they are absolutely not. Because every PSW I know, including when I was working in long-term care, we always knew. Every single time we knew when an inspection was coming. There was extra bodies on the floor. Everybody had name tags. The linens were fresh and pressed. All the supplies, whether it was briefs, face cloths, soaps, you name it, it was overstocked. But on a regular everyday, running around going, anybody got any medium briefs left? Anybody got any face cloths left? Like, this is ridiculous. So don't tell me that they don't know and that they're surprised. The vast majority are not surprised. They know. The PSWs know. They all know. And the other thing that they need to do is those inspections need to be done not just by surprise. They need to be done very biased, with no bias in it. It has to be done completely separate, because a lot of things do get swept under the rug that should not be swept under the rug and get ignored and don't get addressed. And it really makes you wonder, why are they hiding it? The only thing that I can think is, the more reports they have, that generates numbers, and numbers don't lie.
But the truth is, even if they're warned and they're tipped off, we still have such terrible reports from these homes. So, like,
that's very concerning.
What is going on here? The problem is that our inspection regime, unfortunately, is it's just useless the way it is right now. We need to look to models like Australia that actually, you lose your home. Your license will be revoked like this if you do not get your act together. In Ontario, two homes have lost their licenses, not because of neglect and abuse, which we know happens, but because of financial mishandling. And they themselves said, we can't run the home anyway. Take our license away. Wow. We don't actually penalize these homes. We give them written warnings, which amount to what? Wallpaper that lines the offices. And what is that going to do to change behavior? Nothing. What I've said, and what I said very firmly in my conversations with the Prime Minister's office, that I want to see a situation like the US, where they effectively litigated extended care out. Extended care is a Canadian company, by the way, and they were scared out of the US for neglect in the US, right? And they hit them with a $38 million lawsuit, the largest federal nursing home lawsuit. They went after them, the feds, and they said, okay, here's the $38 million lawsuit, but on top of that, you have to enter into a 5-year corporate integrity agreement. And you know what they did? They said, nah, we don't want to do that. Within a year, they sold the entire portfolio in the US, and I imagine focused their efforts on Canada. I want to see criminal charges. I want to see multi-million-dollar penalties levied against these bad actors so they get out of the business of care. That's what I want. And I've been making that very clear. I want real penalties with teeth. I don't want useless written reports. Give me a break.
If I could just jump in here, even that's if they get written reports. I think there's a number of times where, there's no written reports. It's a verbal thing. And it's like, we'll check back in 2 weeks. And it's just like taken as a joke. And it's quite disgusting. And I think like something like that, if you can't track, if you can't measure it, you can't make it better. You can't do anything with it. So ultimately, at this point, it's not about just doing the checks. And I think, just to jump back, to what Lynn said, I think that's a very true thing, because those days when those evaluators come and assessors come, you have many linens, everyone's happy, the meals are getting served on time. It's very performative, if you will. Yeah. And that's problematic. And even with those performative theatrics, it doesn't change the reality of the circumstance. The evaluator is gone and nothing changes. That's not okay. That's not sufficient. And I think there really is a need for us to go back to a time where we have more municipal homes that actually take stock of what's going on and come up with the creative solutions. And just to jump back to what's going on in the city of Toronto, within the region of Peel, they have a cultural approach because they have a diverse population of older folks in the home. So they have everything from, diverse meal programs where individuals can have foods from their countries of origin. And, they try to, work with the residents. And this is being done on a municipal regional government level. So those are some things that we have to take into considerations, and a lot of good lessons to be learned.
And how much happier is a resident, Georgette, if they actually feel like they haven't parked their culture when they've moved into an assisted living facility?
Absolutely. And I mean, and you have to think about it realistically. You're at an age or a stage when you're older, like, you're living and you're seeing your family, but you want to eat good food too. I think that's a normative, desire.
The number one thing they take care about.
That's what it is.
Food.
And the thing is, I mean, and especially in the private, in the private nursing homes, if we're now, bringing food in and it's low quality, and again, it goes back to cuts, because we know for a fact, if I'm not mistaken, like the average cost per plate for a resident is something. It might be like $5 or $6 or something like that. What they're doing in the private nursing homes, and we have prisons that are feeding persons that are incarcerated at, I think, about $12 a day. This is bizarre. This is really concerning.
Yeah.
Yeah,
I think they get under $10 a day. Yeah.
So,
yeah, I think the last report, it was somewhere around $5 or $6 per plate. And Georgette's like bang on that. Absolutely.
So I want to try to show people, Samia from our team, who, by the way, for folks watching this, the only reason this is happening is because Samia Wright, an extremely talented person in our office, is making this happen. And a million thanks to you, Samia. I was saving to them, but I'm going to try share screen, Samia. So everybody brace yourself, because Joel and technology, tenuous relationship. But if this works, it should work. All right, here we go. Can you see that?
Yes.
A HuffPost story?
Well, you know how this all started, right?
Please tell us.
Did you not see my tweet? So I tweeted about this about a week before this. I got a picture sent to me from a family member of literally a half a piece of bread and 2 disgusting looking sausages. And that tweet went viral. I didn't expect it to. And then since then, Yahoo did an investigation into the food, and then this study just came out. Yeah.
So yeah, folks, these come from a private home, Chartwell Home, in the Greater Toronto area. I encourage you to look up this story. And thank you, Dr. Viv, for blowing the whistle on this. I know my colleague and our friend, NPP Lisa Gretzky, has been making similar waves where she is in Windsor, tweeting the fact that this is what
I sent her that.
Samia's asking me to make it full screen. Let me see if I can actually do that.
And there's actually a group in Facebook as well, where there has been it's the Advocates for Long-Term Care Reform group. There's been very similar posts from a family member almost daily on the different foods that their family member is getting served, even when they have dietary issues and restrictions, such as, needing purees or whatever the case may be. And I'm looking at some of these dishes and going, my God, I would not feed that to a dog I didn't like. And I like all dogs.
Yeah, I'm on your dog train there too, Lynn. Yeah. So here's a question that just came. Well, here's a comment that just came in before I throw to the second question we've had in. Dana, who's been a PSW for, might be retired about, but 36 years ago, Dana writes, my pay was more than it is now. So still working. 36 years ago, more than it is now. The staff ratio was 1 to 6, 1 staff to 6 residents. The quality of care was substantially better. And then she reads, then came Harris and Ray.
Yep.
Ray and Harris.
She's right.
So I also want to throw to another question. This is from Peggy. Peggy's raising an issue that we've worked on a lot here locally. Peggy writes and asks, can we discuss how relatives are blocked from their loved ones by homes when they advocate for them? I know if you're watching this, Mary Sardellis, who is one of our city's amazing warriors, and her mom Vula, who's in long-term care in Ottawa West Nepean, Mary had to defy a trespass order.
Yeah.
In her case, and wait for the police to come to the home to see if that trespass order would actually be carried out, and the police didn't carry it out. But Mary is currently the object of a $3.5 million lawsuit from this retirement home for speaking out for her mom. Our office is supporting Mary, and we want the province of Ontario to make it absolutely clear that homes themselves do not have the power to trespass people. But many have complained to us, and Mary is behind a network of advocates that is saying this is happening. This is happening in retirement homes. This is happening in assisted living homes. This is happening in long-term care. Who wants to have a first crack at this? Like, how does this, is this as widespread a practice as many are alleging? What can we do to fix it?
Absolutely. Happens all the time. Happens every single day. And then what happens is once again, when the family member speaks out or wants to question the care that their family member is getting, or something that is being brought to the management's attention, and it kind of goes to your whole predatory thing, is they're being silenced and the family is backing off. And that's exactly what they want. It's a bullying tactic. They want the family to back off. And the family will back off because they're now afraid that their family member is going to be the subject of the target that will now be on them for trying to speak up. That is wrong. That is unfair. And it is a hard enough decision for any family member to put their family into long-term care. That is already a hard enough decision. And to make the families afraid for what they may or may not encounter in long-term care, that's scary. That is not, how is that conducive to a loving, caring, giving environment that you're supposed to feel confident in putting someone you love deeply in? That never ceases to amaze me, because families are getting barred. They're getting told they can't come in. They're getting ignored. Like Dr. Viv mentioned, they all scatter and disappear. No. Especially when you are the POA, especially when you are the primary. Exactly. And that is your job as a POA. Yeah, and the kicker is, if I were to get looked at for neglect of one of my residents, I'd be fired immediately. And depending on the level of neglect, I can also be held criminally responsible. So how is it that you, the government and the authorities, give me the bottom of the barrel, and everybody else that's a PSW, you give us the bottom of the barrel, the most responsibility, and yet you can go after us, no problem. So you want us to be accountable, but you don't want to be accountable. That seems legitimate.
Georgette, Dr. Viv, I heard you both commenting in there. Did you want to get in on this particular question of being trespassed or families being trespassed?
I don't hear the trespass order actually happening all that often, but intimidation tactics happen often. Over the course of this pandemic, I've had families that have spoken up tell me that they've been threatened with potential slander lawsuits. They've been, sent warning letters from lawyers of certain for-profit homes. And for not even necessarily tweeting anything even about the home, just about tweeting about for-profit being bad. And just, it's ridiculous level of intimidation and bullying. And I mean, where is our government to say that this is not okay? Like, you should not be bullying family who are just trying to represent the interests of their loved ones, because we all know that they're not being provided the care that is required because of the conditions. The way we've set up care to be delivered in these homes it amounts to nobody winning. Workers can't do it. They don't have the time to provide proper care. And then the residents don't receive the proper care. And then you go after the people who are whistleblowing. I mean, this is a very dangerous culture of secrecy and complacency in this sector. And we have to really come at it from both ends. I mean, we need the government to step up and say this isn't okay, and you need to defend the rights of both residents and workers and their families. And you need to hold bad actors to account. And right now they're getting a free pass. They've gotten a get out of jail free card thanks to Bill 218.
Explain that a bit better, Dr. V, just in case people don't know what Bill 218 is.
Well, Bill 218, it hit record speed in October. In under a month, they managed to create a law, the Ford governments. Keep in mind, they had, 10 months to do a staffing blitz, implement, infection prevention control, leads in each home, do all the things we've been asking them to do. No. But in under a month, you can put together a law that shields nursing homes from COVID-19 liability. So now, negligence, A-okay. You can accidentally kill people, and that's okay. That is this new despicable legislation. Now you have to prove gross negligence. And this is precedent setting. As soon as this law was passed, I held a a webinar with a long-term care lawyer and families from, the first wave Orchard Villa families, saying just how now they've created this new precedent-setting standard that nobody even knows what does count as gross negligence. This is all going to be very, very interesting when it comes to the courts to see how this plays out. And I'm pretty sure they're still going to be able to win their cases, because what we're seeing is very clearly gross negligence in many of these homes. But the fact that you are now making them have to prove gross negligence is so upsetting to these families. It's just an extra slap in the face, which is so unnecessary with what they've all been through. You've legislated negligence. What government has done this before? This has never happened.
I remember being in the chamber.
You were angry. I remember your talk. I was moved.
You're kind. It's my Irish side. I blame my wonderful grandmother. But the context with which this bill was introduced, just Georgette and Lynn, in case, I think Lynn, you did see that, but Georgette, for your benefit, is this bill was being introduced to protect hockey coaches and dance studios that were trying to offer, safe places. And were they to make an unwitting mistake, they wanted to have a piece of legislation to help those community groups that were just trying to do right by kids and people trying to, get their wiggles out and have their moment of joy in this very difficult dystopian time. It still hurts to talk about that, because I love all those hockey coaches and dance studios and community groups, and they have nothing to do with.
But people were not dying in those situations.
Absolutely.
So people have said, then fine, if you want to protect these small mom and pop businesses, then take out long-term care, take out nursing homes from the legislation. But they wouldn't.
No, they would not.
Who was it really there for? Come on, it's so transparent.
We should just ask Melissa Lanceman, Dr. Vic. Who's running for office, by the way, in York Center. If you live there, do not vote for this person to be your conservative representative. That's my advice to you, socialist to conservative.
Don't worry, I don't vote for PCs anyway.
I'll admit, I have conservative, liberal, agree. I have friends across the political spectrum. If you live in York Center, please do not vote for this person. So I want to go to this next question written to us from Bassam, who writes, better pay and benefits. Besides better pay and benefits, what changes would any of you propose to ensure that the standard of care is the same quality across the province? It's an interesting question, like north, west, east, south. Why are some homes having breakouts while others aren't? What are those homes doing better? And what can you take from them and implement across the board? That's Bassam's question. Who wants to take a stab at that?
They're following rules. Frankly, it's national. We need national. This is why I'm pushing for national standards now, because I've realized that you cannot put this at the responsibility of any given premier. It's just not fair. It's not fair that if you live in one province, Ontario, you have terrible outcomes in long-term care, and other provinces is much better. I mean, that's ridiculous. We should have universal care, right? We have universal acute care. Why don't we have universal long-term care? I mean, it was a complete mistake to leave it out of the Canada Health Act. But again, keep in mind that was created at a time where we had stay-at-home moms that did this care, this very difficult unpaid reproductive labor in the households, hidden. But the second wave of the women's movement, thank God, right? We could go to work. And that helps us in our old age be more, economically stable. So this is a good thing, because a lot of women right now, elderly women, live in deep poverty because of this. They relied on their spouses. So yes, but what we didn't address was the fact that we lost this huge army of reproductive laborers, and we didn't offset that with policies and with more, with actually publicly provided long-term care and home care, because home care is just as bad, and we're going to run into a huge problem with privatized home care the same way if we don't fix this now going into the next 10, 20 years. So national standards, I mean, we need to make sure there's a certain, standard of care. And this 4 hours, by the way, that was created over 10 years ago. You actually talk to the experts who are writing in this now, they're saying it should be 6 hours, 7 hours. So the fact that, we were sitting here begging to try to get 4 hours in 5 years, and they're acting like this is this big gold standard, like they're doing us a favor, when actually that was, that standard was 10 years ago, when people weren't living as long as they were and were more medically complex and fragile, our long-term care resident population. We need a higher care standard. I'd like to see 6 hours. I want to see standardized pay across the board for all, nurses are already taken care of through their college, but we need some sort of parallel college of nurses, but for like college of PSWs. We need something like that, where there's standardized pay across the board, standardized training by a reputable organization. We need to completely overhaul the penalties and, inspection regime. We need to borrow from Australia's example. And that includes worse penalties and better enforcement. And obviously, I think going forward, we would be so stupid if we kept giving contracts to for-profit builders when we have such clear and glaring evidence of failure of the for-profit sector. I just do not understand how we can carry on going forward in any good faith, allowing profit to remain in long-term care.
Georgette, Lynn, anything you wanted to add about what we could do to make sure standards are better across the board?
Yes, I would jump in and I would agree wholeheartedly with everything that Dr. Viv has said. The national standards are mandatory. Your level of care, your quality of care cannot be determined by where you reside in the country. So for sure that we need national standards. And on top of that, we do need regulation, and we do need real regulation, that there's actual outcomes and there's actual penalties. And then also perhaps if you're, if for whatever reason we want to maintain having these private places, that there's not only public shame, but they lose their license and you're not allowed to go back into that practice. Because if we don't have real consequences, then, what happens? They just go back into it under a different name with another friend or whatever the case may be. So there needs to be real consequences that are put in place. And it needs to remain a priority for all levels of government, because these are the people in the country that we can't just forget about just because now they're at an older age and whatnot. That's not fair and that's not right. And if we could look at it in a very simplistic terms, right? We were all children at one point. We were all kids, right? So when you're young, your parents take care of you. And now when we get older, we have the responsibility of taking care of our elderly folk. That's plain and simple. There's no ifs, ands, and buts around it. And it is concerning, highly and grossly concerning, that we're still having these type of conversations where, things haven't moved. We need national standards, without a delay.
Lynn?
100%. Everything that both Dr. Viv and Georgette have said is 100% everything I would have said as well. And, we're at a point now where we have to start asking these decision makers, they may forget that they are aging as well. Will they be okay with going into one of these homes tomorrow?
Yeah.
Good question.
And Georgette, you said something that I always bring this up in interviews. Ask yourself right now, if we had over 3,000 deaths in daycares,
good question.
Would those daycares be up and running still with no penalties?
Absolutely not.
I want people to remember this is a very glaring trifecta. Well, actually, it's 4 points here. This is racism, ageism, terrible ageism, sexism, and ableism. We have a majority female, older, disabled population being cared for by a majority female, racialized population. Give me a break. This would not happen in any other sector. And people need to look at themselves and really reckon, what kind of person are you if you are okay with what you are seeing? What does that say about how you support our older population? What does that say about how you support women who are doing the majority of this work? What does that say about how you support racialized women who are doing the majority of this work? I mean, come on, this wouldn't be happening in a different sector.
It's an excellent
You're
point.
right. You're
Excellent.
right.
100%.
Jennifer is asking us a question. I think it's a fitting one on which to end. And then I'm going to ask each of you to offer our viewers any closing thoughts you may have. Jennifer writes, other than protests, writing your MPP, the Premier Media, is there anything else you can suggest to families and the public that they can do to get help for the long-term care situation and future changes needed for these homes and these workers? What advice do you folks have as advocates to offer to people tuning in right now?
That's the
Don't
question
stop.
I get asked the most. That's the question.
So let me start. I don't mind starting, and then you folks can round it off. I will say this, Jennifer, your story is more powerful than you think. I remember watching the town hall that Dr. Viv did with my colleague Dolly Begum for the families at Tender Care that suffered that just horrific outbreak over the holidays when the government had effectively gone to sleep.
Went on vacation.
Went on vacations, leaving vaccines in the freezer with no vaccine rollout plan. It breaks the heart to know that had we had an active mobilization program, we could have gotten shots into the arms of people and they could have survived. And the latest that I have seen, and correct me if I'm wrong, folks, you're more knowledgeable than me, that is still happening. We still are not moving these vaccines out into the community quickly enough. We're putting as much pressure on it as we can. But your story, Jennifer, and anybody else watching this who is either working in the sector, who has families or loved ones in the sector, is more powerful than you may think. And even if you're willing to share it with someone like me or Dr. Viv or Georgette or Lynn anonymously, it is still powerful. So if you're watching this and you're wondering, you may be feeling powerless, you may be feeling like you can't do something, but there is something really difficult going on in your life because you're working in the sector, because you have loved ones, or you are a resident of a home right now watching this, make sure to pick up the phone. Even if you don't live in Ottawa, you can call us. You can get in touch with us, and we will do our very best to make sure your story is heard. Podcast is going to be made out of this particular town hall. We're going to make sure all these fantastic women who've shared their thoughts with us tonight get their perspectives heard by people who tune in to us, and your story will be part of that. And the story that Lynn told, I also want to point that out about how you connected Lynn with that previously nonverbal resident and made him feel like he mattered. And listen to him. I mean, as I have talked to people who work in the sector with such heart-forward approaches to life, that is the juice. That is the stuff. That is what we should have. So I want, again, before I throw to you, Lynn, I want us to imagine, can we build a system where the floor is a living wage, where we have completely clear infectious disease controls, and we make sure profit no longer exists in this sector, in both long-term care and home care, all assisted living facilities. Can we imagine that? I would say, Jennifer, your story can contribute to that movement. It's part of that. And anything we've ever won, I know the elders in my own party, in the Democratic Party, will often tell me, Joel, Medicare is not a fait accompli. We fight for it every day. And we need to remember, it was a big victory our generation won for you, but you have to keep fighting for it. And you have to keep fighting to expand it. And there are a lot of people in this country who work very hard to get us to where we are now. And we have to build on all of those stories and all those energies. Lynn, over to you for your closing thoughts. What do you think? What's your response to Jennifer? What can we do?
Just don't stop. Do not stop. Do not be intimidated. Do not be silenced. Make calls. Call Joel. Call me. Email if you want to stay anonymous. Dr. Viv's always readily available. Georgette's available. We're all available. There are so many different resources that are out there that I don't think are given enough spotlight. And that is definitely something that I'm going to start right now. As soon as we are done, I'm going to start connecting with the people that I do have connections with, that have these coalitions going, that have these groups going for connecting people. Absolutely. Just don't stop. Do not ever stop, because the minute you stop is the minute that they think they've won. And that goes not just for the family members of people that are in long-term care or even home care community. That goes for the PSWs too. Do not stop speaking up. Do not be afraid. Do not lose your voice, because it's your voice that matters. And it doesn't matter if you're whispering in someone's ear or you are screaming from the rooftops. Your voice matters. And you can take 5,000 little voices, and as long as they're all saying the same thing, doesn't matter how quiet they are, the reverberations from it will be so loud. Keep going. Speak up. Don't be afraid. Connect with any of us at any time to ask, what should I do? There's never any stupid question. The only stupid question is the one you don't ask.
There you go. And
it's not even stupid. It's just that it needs to be asked. Don't think your questions are silly. Everybody has questions. PSWs have questions, 1,000 of them, because everything's coming at everyone so fast. The information is coming out from every which direction. Nobody knows which way to listen or turn or look or read. So there are questions from everywhere. I have questions. Joel has questions. Dr. Viv has questions. Georgette has questions. That's why we do these things and have these meetings, so that maybe something will get brought up that somebody might be too afraid to ask or speak up about.
Awesome.
If I can just jump in quickly, I would just 100% support that. I would only add to that, like, ask somebody. If you don't know where to go, you have a city councillor, you have a regional councillor, you have a provincial representative, you have an MPP, you have a federal minister representative for your area. So sometimes the hardest place to start is from the beginning, but you have these people. They may have sent you something when the elections have gone on. You may have a magnet on your fridge or something like that, but ask the hard questions. Even if you just don't know, if you want to get a better idea, and ask, what's being done or what can be better done, because you have concerns. The numbers are posted online every day at the Ministry of Long-Term Care for the amount of not infractions, but how many cases there are, if there's staff cases, how many are resolved. So follow those numbers, and if you see something egregious or something, ask. You're entitled to do so.
Yeah.
Thank you,
Yeah.
Georgia.
Be diligent, take notes, write everything down. One of the greatest things that has come from this, year and a half, well, this has just been a nightmare of a year, is that families have said that, coming online and going on social media has connected them with a community. And that makes them feel so much less alone, because these families are savvy. They trade tips, they trade information, and having that support system is so important right now for these families.
Mm-hmm.
You'll learn strategies from each other. You'll learn, you could contact the Advocacy Center for the Elderly if you have questions about legal issues. You should be launching critical incident inspections. If something is wrong and you are unhappy, call the ministry, demand an inspector go in the home. That documentation is critical if you end up pursuing civil litigation, which unfortunately many families have to do because there's no proper way to get accountability in our public system. The only option to get some sort of measure of justice, to be told, you were right, they were wrong, they did not fulfill their duty to care for your loved one, is unfortunately through the courts. So document everything, put your complaints in writing, you email anything that stands out, and you come to us on social media and we'll connect you with groups of people that can support you.
So,
and the last thing I want to add to that is the same thing I say about every situation. You have a right to not only have that information, the education, but you also have a right to understand it. So if you're being told something you don't understand, do not be afraid to ask for clarification. I don't care if it's 5 times, 10 times, until you have a clear understanding of whatever it is you're being told, ask. And
or
if
invite
you're not
people
giving
with
answers,
right?
go
Invite people with you to be on that call if you don't understand, right? I had tender care families ask me to join in the town halls that were from, being held from the hospital that took over them, because, a lot of them was, English isn't their first language, and they wanted someone to help understand what was being said. I mean, don't be afraid to ask for some supports in all of those correspondence.
So the constant I'm hearing throughout tonight, folks, and thank you, Georgette, thank you, Lynn, thank you, Dr. Viv, thank you at home for tuning in, is that we got to make some trouble, okay? And you got to know that your voice matters.
We're good trouble. That's what they call me.
We're great trouble.
I'm good. I'm fine being trouble as long as I'm good trouble.
I would put you firmly in that. I also want to acknowledge someone who's been inspiring me as I've been thinking about PSWs and PSW education. Laura Bulmer, who's a professor at George Brown College and someone who knows a lot about PSWs, is mentoring and helping the next generation. Laura, thank you for all your work. I look forward to continue to working with you. I also want to thank my colleague, Mike Mantha, MPP for Manitoulin, and Wayne Gates, MPP Wayne Gates from Niagara Falls. Both of you have worked tirelessly and very hard to advocate for people in the sector. I want to thank my colleagues for tuning in. And look, as I said, we are proud to have a podcast, Samia, myself, Peyton, and Kieran, that we're going to curate. We're going to curate an episode out of this, and you're going to be able to tune in. So if you do listen to podcasts, you can find us there, either under my name or under our name, which is Troublemaker Radio. That is our radio station. That is where this content is going to be. We want you to like, subscribe, and share it, because this is how we can get change. This is how our grandmothers and grandfathers got change, and it's how we can get change too. Georgette, Lynn, Dr. Viv, thank you so much for joining us tonight.
Thank you.
Thank
Bye,
you.
everyone at home.
Thank you for having the conversation.
All right. And Samia, thank you so much for making this happen. Samia Raida from our office.